Hi, I'm Benjamin Levy, a gastroenterologist at the University of Chicago. Here are 10 tips to build trust and improve the patient-physician relationship. Number 1, I highly recommend reviewing the patient's chart and past medical history before going into a clinic room to see a patient. If possible, try to have your nurse obtain any needed previous medical records, like previous colonoscopy or EGD procedure reports in advance. Being well prepared will place patients at ease, improve trust, and expedite care. Sit down when talking with a patient and look them in the eyes instead of focusing on the computer screen. Physicians should never tower over patients. Be mindful that you are sitting at an equal level or sit lower than the patient. Try to arrange the furniture in your clinic room so that you can easily see the patient from the computer. Number 3, if you like to write your note with the patient in the room, I recommend that you read out loud sections of the note as you type. Patients love experiencing the great attention to detail that we include in patient notes. Flower your note with specific details like what the patient does for a living, their past medical history, and medications. Read out loud a simplified version of your medical workup and management plans while you type them. This recapitulation emphasizes the important parts of your recommendations. The more times you state your plan, the better patients will understand and remember. The best way to end a clinic visit is to ask the patient to recall and explain the plan to you. This ensures patient understanding. And use this opportunity to correct anything not fully understood. This extra step also shows that you care and that you're invested in a positive outcome. Make sure that your patient education handouts are understandable on a 5th grade level. Have copies available in the most common languages as your patients. This is important for immigrants and refugees especially. Take advantage of the specialized handouts that GI societies like the American College of Gastroenterology provide to members for use in your clinic. These handouts illustrate that your care is standardized, congruent with physician thought leaders, and that you are active with your national physician organization. Number 6, whenever you can, walk patients out to the front desk for checkout. And in front of the patient, emphasize to scheduling staff any urgent tests that need to be scheduled. Patients will love your advocacy work and attention to detail. This simple step builds rapport with patients, and they will remember you as the doctor who went the extra mile. Number 7, set up your clinic schedule in a manageable way so that you stay on time or even ahead of schedule. Patients appreciate it when you value their time too. Now keep in mind that many patients must take breaks from work or even taking care of loved ones to attend your clinic visit. Patients will remember, admire, and recommend punctual physicians. It's sometimes difficult to fit everything you need to do during one clinic visit, so provide a review of systems checklist for patients to complete before their clinic visit. The waiting room is a great opportunity for this right after check-in. This will speed up your history taking, and I also recommend that you educate your nurses and support staff to teach patients how to prepare for colonoscopies and schedule their procedures. These small steps will help physicians stay on schedule. In the hospital setting, try to avoid obtaining history and physicals while someone else is working on the patient. Getting blood pressure, starting a line, patients will feel rushed and might not be able to concentrate on the medical conversation if 2 different healthcare professionals are interacting at the same time. It's courteous to do one thing at a time with the patient. Write excellent clinic discharge summaries that read like empowering recommendations. I personally number each recommendation and place in order of importance. I recommend writing clinic and inpatient discharge recommendations in easy to understand language. And in the discharge summary, I reference each medication that I've either started or discontinued. And if needed, describe possible side effects for the patients to look out for. This technique dramatically improves patient adherence to our recommendations. Number 10, patients love it when you call them at home to check in on them, to follow up on abdominal pain or nausea or constipation. It shows that you really go the extra mile for them. Instead of answering a patient's question in the electronic health record, call them for a quick conversation. Patients will recommend you to their friends as a compassionate doctor who truly cares for patient happiness and excellent clinical outcomes.